Good afternoon, everyone. Thank you for joining us today for an MP webinar on COVID HR policy updates. I'm Amy Weeman, Head of Marketing here at MP. And for those of you joining us on a webinar for the first time, MP is a full-service human capital management company with a full suite of products, including HR, payroll, benefits administration, time and attendance, and compliance assistance. We support our clients with cutting-edge technical solutions, as well as proactive, reliable service and deep HR and payroll expertise. At MP, we are wired for HR and help our clients succeed by aligning their people strategy with their business goals. I'm excited to introduce to you your presenter today. He's MP's VP of HR Services, Paul Carelis. Paul has over a decade of experience in the HR consulting space, working across a number of industries of all sizes and types. Paul and his team of certified HR professionals assist clients with compliance, training, and full circle HR guidance and support. Just before we get started today, if you would like to submit a question during the program, please use the Q&A feature at the bottom of the screen. And also a recording of the webinar will be sent out later today following the presentation along with Paul's slides. And with that, I'm going to hand the mic off to Paul.
Great. Thank you so much, Amy. Welcome, everyone, today. As usual, a very timely topic or set of topics we'll be talking about. As much as we'd like to think or believe, or maybe a couple of months ago, really thought that we were post-pandemic. Unfortunately, we are not. But that being said, it's a mixed bag in terms of which forms of relief or programs either set up for employers or employees are in place or expiring and frankly expiring as of today. So quick legal disclaimer, this training is intended from an HR educational standpoint, not an attorney, so please don't construe anything as legal advice. Also, another important note is that all the information, in case you're watching a recorded or rebroadcasted version of this, the information that we're discussing today is relevant and accurate as of September 30th, 2021. So what we hope to cover in today's session, first will be an update on the vaccine mandates, definitely a hot topic this month. We'll also talk about COVID sick leave, both from the federal COVID sick leave programs as well as some at city and state levels. We'll talk about the end of the COBRA Subsidy program and what you need to do as an employer. We'll discuss HR strategies around all of these things. We'll also do a quick update on the Employee Retention Tax Credit Program, as we're getting a ton of questions on that and the fate of that program. And as Amy said, if you do have any questions related to any of this stuff or anything that you feel might be related to this stuff, including ERTC, feel free to pop those in our Q&A. And we will do our best to address those either here live or follow up. Okay, so first, let's tackle the vaccine mandates. So there's been a lot of press and publicity dating back to September 9th when President Biden issued executive orders. The real attention grabber and the one that really captured the headlines was the mandate for all employers with 100 or more employees. But really, there were kind of three separate orders issued that day that affect three different types of businesses. The first of which was an order for federal contractors. So just a mandate for the employees of federal contractors that they would need to be vaccinated. There was also an executive order that covers Medicare and Medicaid certified facilities. So pretty much any type of medically related business that accepts Medicare and Medicaid as forms of payment. Nursing homes, long-term care facilities, hospitals, doctors, what have you. Employees of those organizations are also facing a potential vaccine mandate. And then finally, there was the mandate for private sector employers with 100 or more employees. Some key differences between those three, at least what we know now. So we'll talk about what we know and what we don't. Based on the original kind of draft form of guidance within the executive order that's sometimes a little bit light on detail, the private sector employer mandate does have the alternative of a weekly testing requirement. But in less of cases of a valid exemption and the details of that we don't yet know, and how many exemptions they're going to allow or what kind. The federal contractor mandate and the Medicare and Medicaid certified organization mandate does not have that alternative to do weekly testing. It's simply you either have to be vaccinated or meet one of the qualified exemptions, or you're kind of in a tough luck scenario there. So what we do know is that earlier this week, or it might have been late last week, losing track of the time here, everything's moving so quickly, there was federal contractor guidance issued, or at least some initial guidance in terms of the program as it pertains to federal contractors. Interestingly, the guidance did state that this mandate will apply to contractor employees, both on-site as well as remote workers, which at least I didn't quite expect. In addition to the vaccine mandate, in terms of those who are working on-site at contractor workplaces, there will be masking and social distancing requirements as well, and that applies to both employees as well as visitors to those work sites. It's important to note, they also noted that it does not only apply to employees working on a government contract, a federal contract, it would apply to all the employees working at that site as well. There's also a requirement for the company to designate either an individual, someone like a safety officer, or have a committee to ensure that the federal contractor is acting safely when it comes to COVID-19 precautions, and to monitor compliance with the regulations as they roll out. Some other key aspects of the federal contractor vaccine mandate. And again, this is simply the federal contractor piece. This does not necessarily apply to the others, the Medicare and the Medicaid, nor the private employer. So this doesn't necessarily apply to existing federal contracts, but it will apply to all eligible federal contracts awarded on or after, or renewed after November 14th of this year. There will be a deadline for compliance with all the aspects of the mandate of December 8th of this year. As of right now, contracts with a value of less than $250,000 will seemingly be exempted, although they will be encouraged to still follow the guidance and the mandate. In terms of the types of federal contracts, they're generally focused on contracts providing some sort of service. If it's a federal contract that is solely providing products, manufacturing, things like that, those, as of right now, are also excluded. And as I mentioned a few minutes ago, as of right now, for the federal contractor mandate, there is not an option to waive the vaccine requirement and instead do the weekly testing like there is for private sector. Okay, so what are the remaining questions? Well, there are countless ones, but among the remaining questions, definitely we're waiting on guidelines for the Medicare and Medicaid certified organizations, as well as private sector employers. We can't gain or gather too much insight based on the federal contractor regulations as they'll apply to these other groups, mainly because there are different governing bodies issuing the rules and the regs. So the federal contractor guidelines were issued by what's known as the Safer Federal Work Task Force. The private sector rules are going to be coming from OSHA and the Department of Labor. So when it comes to things like remote workers and whether or not they'll be required to meet the guidelines and the mandate for vaccination, we don't know. And while it is in place for the federal contractors, OSHA might see things differently. So that isn't necessarily a slam dunk. One of the real burning questions and what people are already really inundating the Department of Labor with is when it comes to those who are opting for testing rather than vaccine, who's going to be responsible for the cost of that testing? Will that be an obligation on employers? Will they be allowed to have the employees bear that cost? And then from a wage and hour perspective, is that testing going to be considered compensable time? Will employers need to pay employees or allow for time at the beginning of a shift or ahead of a shift or otherwise compensate for the time that it'll take for the employees to undergo that COVID-19 testing. And then we're also really hoping for some clear guidelines for exemptions. Most cases that have come up so far have really narrowly defined what is a true medical or religious exemption. Many religious organizations are distancing themselves from being included as counting as an exemption. So we imagine the list will be very narrow and small, but that does remain to be seen. So we're not ready to make a clear definitive statement on that just yet. Other remaining questions include the timelines and the effective date. So for those federal contractors, it looks pretty certain that December 8th will be that start date, although that could change if there is a court challenge that has some success and creates a stay of the mandate or what have you. There are sure to be and already have been some court challenges on this. I believe Arizona is challenging the private sector employee mandate. I will say that individual cases where employees have sued for delays or sued based on the constitutionality of a vaccine mandate at an employer, the ones that I've seen and studied have always sided with the mandate or with the employer. So there was a big landmark case in Houston with one of their hospital systems where the hospital network did have a vaccine mandate. The employees challenged that. But they lost their case in the appeals court, the district court. So that mandate was approved more recently. Some Massachusetts state troopers sued to delay the state police's vaccine mandate that's set to take an effect. And just this week, the court sided against them in that. So as these cases pile up to date, just about all, and I don't know of anywhere where a mandate has been ruled or shot down, the mandates have stayed in effect. Obviously, something that's covering every employee of companies that have 100 or more employees is a lot more far-reaching than an individual institution or company. So we'll see if any of these have legs. But as of now, we're proceeding as if these mandates will take effect once the rules have been issued. We don't have too much clarity yet also on penalty mechanisms and amounts. A number that was originally floated up there were penalties for the private sector employers of up to $14,000. There's also been some rumors within the last 24 hours that something has to be included in the reconciliation bill currently in Congress. Could have those penalties increased quite dramatically into the tens of thousands of dollars, not hundreds of thousands of dollars. But again, how those will be, what the mechanisms will be for those penalties, whether it'll be a complaint system or an audit system or a reporting system, and what those actual amounts will be. And if there will be a sliding scale like many OSHA penalties are, when they can be greatly multiplied and magnified when it's found to be willful violations of safety rules versus accidental or administrative violations of safety rules. Well, that remains to be seen as well. We also don't know what will be in place in terms of aggregation rules. So when there is an entity that has multiple federal IDs, multiple locations, and the ownership stake in those, if those employee counts will need to be aggregated for terms of determining size. There are also state and city level regulations that may differ in certain key ways from the federal vaccine mandate. So interaction with those will be interesting, as well as interaction with private policy. So if we go to the next slide, we can talk about what some larger businesses are currently doing when it comes to kind of being ahead of the curve here, or ahead of the actual legal mandate. Delta is doing something very interesting. I believe they do have a vaccine mandate that they're rolling out as well. But in addition to that, for employees who are not getting vaccinated and who participate in their group health insurance, Delta is tacking on a $200 monthly charge on top of their existing health insurance costs to employees who are not getting vaccinated, citing the cost of COVID-19 and medical services treating people who test positive for COVID-19. So they're doing a $200 surcharge on their health insurance. Cisco is taking the route where if you want to be in person or be doing anything within their offices, you need to be vaccinated. They are allowing remote or employees who otherwise don't come into the company's offices to not be subject to the vaccine mandate. Obviously, that may change depending on how the OSHA rules end up coming out in terms of treating remote workers. Ford's current policy is a vaccine mandate, but only for those who are doing international travel. So again, that will change as the rules for the vaccine mandate roll out. And then Tyson, I think it was a couple months ago now, announced a more kind of traditional vaccine mandate for all their workers. Believe their office workers had to be vaccinated by tomorrow. The field and factory workers had to be vaccinated by November 1st, so there's still a month to go there. And they just actually, I had this slide in here anyway, but as I was reading the news, I saw they did just kind of report their results so far. So before they issued the mandate, Tyson said that fewer than half of their employees were vaccinated. And as of today, they're saying that 91% of their workforce is vaccinated. So definitely a huge increase in vaccination rates. They didn't talk about any potential turnover or people who left as a result of the mandate, but they did say that over 91% of their workforce is now vaccinated. So I'm going to take a quick look at some, it looks like we got a question in here. All right, so on the ambulance service that accepts Medicare payments, the order was written for federal contractors and has the language of any organization that has a contract-like instrument qualified under the program. So the question is, if someone technically has a federal contract and accepts Medicare payments, which rule will they follow if the rules are different? So we don't yet know. I think once the Medicare and Medicaid rules are released, which should be fairly soon, there should be a discussion, because I believe there are a number of businesses who fall under both categories. Ambulance service is a great example of one. But there should be some directive within the regulations in terms of which rules would need to be followed. But we will be sure to update folks once the kind of second hammer falls there. Okay, another question just came in. Please confirm all mandates currently apply only to those private businesses over 100 employees. What, if any, mandates apply to small businesses under 100? So in terms of vaccines, at least at the federal level, yes. As of right now, it'll only apply to private businesses over 100 employees. Again, different story potentially if you are a Medicare or Medicaid certified organization. Again, we're waiting for the rules on that to come out, but that could affect smaller employers. You do also want to check wherever you have employees located, both at the city and state level, as those smaller governments decide or start to pass localized vaccine mandates or rules or regulations, because those would supersede any exemption you have as a smaller business, potentially, depending on the rules. But as of right now, at least from a federal standpoint, not knowing where you're located, there is not a vaccine mandate in place for any businesses. And frankly, even for the larger ones, the rules aren't out yet, so there's nothing in play right now where you're in any type of violation as of today. Okay, so question here, will the employer be responsible to pay for the test and the employee time taken to receive the test vaccine? So that is one of the most burning questions. We've posed that question to the Department of Labor and to OSHA. We haven't got an answer yet, but we do almost guarantee that will be discussed when the rules are released. So when the executive order was signed on September 9th, they said the OSHA rules would follow in the next several weeks. So really, we're hoping that sometime here, tomorrow will be October, so we're counting on those to hopefully be released sometime in the month of October here. But we haven't been given any sign of a date that those rules will be published. Okay, so an electronics distributor subcontractor. If you can make the argument that your federal contract is simply solely for the provision of products, you should technically be exempt, at least under this initial guidance. And if anything, if you take anything away from today's presentation, whether it be about this or any of the other programs we're going to talk about, I just really, really urge you to stay up to date before you make any decisions, or just stay on our mailing list, keep attending these Thursday webinars, because all of these things are subject to change. It's really important to note these are accurate as of probably noontime today, September 30th, but things can change in the blink of an eye. So it's really important that we stay on top of this collectively, and that you keep yourself updated, especially when it comes to things like state and city regulations, which can pass very quietly. Okay, so all right, so Massachusetts, yes. So Massachusetts does not currently have a vaccine mandate for employers. We will be talking about the requirements here for COVID sick leave. Massachusetts did just extend their COVID sick leave. We'll talk about that in a few minutes, and we're also going to take a really deep dive into that program in next week's webinar. Okay, so question about locations. That's going to be resolved within the DOL guidance or the OSHA guidance when it comes out, in terms of if you have, if it's going to be like FMLA, where it's so many employees within a 75-mile radius, whether it's 100 employees across all the control groups, organizations, if it's across everyone under the same federal ID, across all locations under that Fed ID. We don't quite know just yet, but we are working hard to get a determination there and get a ruling from OSHA and the Department of Labor. Okay, so some questions coming in about some of the other stuff we'll be talking about, so I'll kind of leave it at that, and we'll start talking about COBRA. So something that's kind of, in talking with businesses, something that they kind of forgot about. We started this COBRA Subsidy program back in April, where anyone who was still eligible for COBRA and who was basically terminated involuntarily and was not eligible for coverage elsewhere was eligible to get fully subsidized insurance through COBRA, but that is ending as of today, September 30th, and has not been extended. One requirement that businesses do have, if you do use a COBRA administrator, they should have taken care of this for you. But if you're doing all of your COBRA in-house, it's something that you'll want to do as soon as possible. Part of the regulations for the COBRA subsidy do require the business to send out a notice of expiration of premium assistance. So basically saying that as of September 30th, the premium assistance, or the subsidies, those are identical terms, just different words for it, but that is ending as of September 30th. And then depending on the situation, either your COBRA eligibility can continue at full cost, or you're no longer eligible for COBRA either. So again, if you use a COBRA administrator, double check with them to make sure that they're fulfilling their requirements there, or your requirements to get those out. If you're doing it in-house, you want to get your hands on a sample form of that notice of expiration and make sure those get sent out. And then when it comes to claiming, because while many employers, and it depends on size, but many companies did kind of have to bear the cost of those COBRA subsidies initially and kind of pay for the premiums, you are able to get that money back through tax credits but you need to get those reported on a 941. And something that's important, they are expecting those to be claimed on the correct 941. So in the case of right now, we're about to file Q3 941s for businesses in the next few weeks. So that would cover the last 3 months, July, August, September. But if you had COBRA subsidies that applied to April, May, or June, or second quarter, the IRS is really expecting those to be reported on the second quarter 941, not the third quarter. They don't want it all just lumped together and grouped into one. So if that is the case, if you did have COBRA subsidies that you haven't yet claimed for insurance coverage and subsidies that were covering second quarter, you may want or need to amend your 941 and file a 941X to claim the subsidy credits on that relative quarter. All right, so let's talk about COVID sick leave. From a federal standpoint, as well as several states, ARPA, American Rescue Plan Act, COVID sick leave ends as of today, September 30th. That has not been renewed. So after today, there will be no more new claims for COVID sick leave. As a reminder, this has been optional all year. This hasn't been a requirement. Businesses have not been required to offer federal COVID sick leave, but it has been available, and many businesses have taken advantage of it, especially since they're reimbursed through tax credits. If you do have an employee who's currently on ARPA leave, if they start it on September 30th or earlier and it carries over past September 30th, they are still allowed to be on that leave, and you still will be reimbursed for that leave. It's just that there can't be any ARPA COVID sick leaves or any other federal COVID sick leaves starting after October 1st or later. And one other important note on this from the federal standpoint, it is important to note that the American Rescue Plan Act COVID leave and the FFCRA COVID leave from last year and from, I believe, the beginning of this year as well, are technically different programs. So if in whatever payroll system you use, you've been reporting time identically, under the same earnings columns for FFCRA as ARPA COVID leave, you're going to want to double check that. You really should have been using a separate field or column for that. There are some slight but significant differences between the two programs in terms of what those earnings are taxable for on the employer tax side, and B, also what they serve as a mechanism as a credit against when you're getting reimbursed. So it is important that if you've used both the old school FFCRA COVID leave and as well as the newer ARPA from April on COVID leave, that those are differentiated in your payroll system because they are slightly but significantly different. Okay, so when it comes to the other COVID sick leave programs out there, it really is a mixed bag. So you really need to take a look at what states you have employees in and what cities you have employees in, frankly, because, kind of without much fanfare, a lot of locations passed some version of COVID leave. There are a lot of states and a growing number of states that either expired or never had a state-specific or a state-specific COVID sick leave, but they do have vaccine leave, so paid time for employees to go obtain a vaccine. And many of those are extended either through the end of this year or sometimes through the end of 2022. So you do want to take a look at that. So California is a tricky one, and I know we do have people on the call here who do have a presence or do have employees in California. So the kind of traditional California COVID sick leave is ending as of today, September 30th, but there are other things in place there. So they do have this California COVID exposure leave. So If the employee can prove, or probably more importantly, unless as an employer you can prove that an employee who contracts COVID got it outside of work, there is a COVID exposure leave available to them that is continuing as of right now. New York's COVID sick leave is an interesting one, and I know we have people on the call here with a presence in New York as well. So interestingly, the way New York drafted their COVID sick leave, rather than having kind of a start and stop date, was they really drafted it and drafted the reasons around COVID-19. So if someone is under a COVID-19 quarantine order, or they test positive, or otherwise have some COVID-related condition or need to miss work, the New York leave law is kind of evergreen in that it doesn't have an expiration date. So as long as COVID is a factor in affecting your employees in New York and affecting their ability to come into work within the limits of the program, the New York COVID leave will continue on. Here where I'm sitting in Massachusetts, just a couple of days ago, Massachusetts just extended their COVID sick leave for another 6 months. So that was set to expire today along with the federal leave, but Massachusetts did extend through April of 2022. As I said, we're going to do a really deep dive into the Massachusetts sick leave next week on next week's webinar. It is something we're starting to get a lot of questions about, and it's important to understand. Unlike ARPA and FFCRA, or the latter portion of FFCRA, this is not an optional program for Massachusetts employers. They are mandated and required to make this leave available to workers. It is different from the federal program in several key ways. There are limits. It's limited to 40 hours, or a prorated amount of hours for part-time workers, basically a week of leave. There are also earnings limits on the leave as well. And then the mechanism for being reimbursed for Massachusetts COVID leave are quite different than other places. It isn't really an automatic tax credit. It's on gross wages. It doesn't factor in employer taxes or anything like that, like some of the COVID sick leave does. And also, it's a fairly manual process for claiming reimbursement. Employers have to go into Mass Tax Connect, log into their account, go into the special section, fill in the information regarding the employee and the amount paid, and claim the reimbursement that way. It's really outside of payroll or a payroll tax function. So both in response to and anticipating all the questions that are going to come in, as this is for Massachusetts employers really the only avenue for employees to use COVID time with the federal program expiring, there are a lot of questions and concerns and really important things to understand about this. So we will be covering that next week. So in terms of an action plan, you want to double check all of your work locations. So for instance, while the California state level COVID sick leave program is expiring, there are several cities, including Los Angeles and others, whose programs are continuing. So more than just knowing what state your employees are in, you want to know what city they're in as well, because there are several cities that do have a COVID sick leave designation. You want to make sure that your federal leave is reported on your 941 so that you get reimbursed for those expenses. If you are in a situation where either the COVID leave that you've been using has expired, or you have employees who have exhausted the leave available to them, you really want to strategize and have a plan in place for what you're going to do should employees have a need to, if they've been exposed, if they test positive, if they otherwise need to isolate or quarantine. What's the plan going to be? What time off policies do you have in place? Do you have traditional sick leave? Do you have PTO? Are you subject to FMLA? Would FMLA apply? You really kind of want to have a game plan and a strategy in place to make sure that as these pop up, as unfortunately they're very likely to, and with that kind of federal safety net gone, what options are there going to be for employees? And once you do have that plan in place, it is really advisable to send out communication proactively to your employees, especially regarding the end of the federal program. So if you are in a state where there is no state level COVID sick leave program in place any longer, it would be advisable to notify your employees and let them know that the ARPA COVID sick leave has ended per the federal law, not your choice, as of September 30th, and that and what time off they may have available to use should they need to use some time. Okay, so before we move on, I'll look at some of the more recent questions as they pertain to some of this stuff. Okay, so question about full-time versus part-time when it comes to the Massachusetts sick leave. As far as I know, unless the extension changed something, and again, this just passed yesterday, so we'll double check, but the provisions in their original COVID sick plan called for all employees to be eligible. They just get a prorate amount. They wouldn't get a full 40 hours if that wasn't their common weekly schedule. Massachusetts has not mandated a specific number of hours for vaccination time. It is one of the allowable purposes of the COVID sick leave, which provides up to 40 hours. Obviously, hopefully someone wouldn't need that much time unless they had some severe reaction to the vaccine. How do we get reimbursed for sick leave from FFCRA? So that would be claimed via a 941, or if it pertains to a previous period, an amended 941. So if you are a MP client and you use the iSolve system, you want to speak with your account coordinator and account manager. We have a business credit screen where we could enter in those figures if they haven't been entered through the normal methods. Most providers, including iSolve, if you are tracking things in the correct fields and correct codes, those credits should populate correctly based on the taxation of the fields and payroll. So you just want to double check with your payroll provider to make sure that you are being credited for those figures and getting the tax benefit. Have you sent out the registration for next week's training based on the Massachusetts COVID sick leave? No. So we were originally scheduled to have the webinar on marijuana and marijuana in the workplace and changing laws. We are postponing that. There are a lot of balls up in the air when it comes to the marijuana laws. Those are moving more slowly than we anticipated, especially at the federal level where there's so much infighting over the reconciliation bill and the infrastructure bill and all the various and the debt ceiling and all that fun stuff. There hasn't been as much progress as we anticipated a couple of months ago that there would be on marijuana. So we're postponing the marijuana session. But I believe by the end of the day, the registration for the Massachusetts COVID sick leave should be up on our website and be going out to people on our list. So either late today or tomorrow, you should see an invite for that or a registration opportunity. Okay, so some requests for information about the California exposure and the New York leave. So I will gather some information about that, and we'll pass that along to you guys along with the recording of today's session. So in terms of some resources, at MP, we have developed a vaccine mandate checklist kind of for the 3 different scenarios and considerations and strategy points. We will be sending that out to everybody. Again, if I can stress nothing more than please know that is a living, breathing document subject to change, especially, it's, light on the details or big on the speculation when it comes to the private sector and the Medicare, Medicaid categories. We are updating it, so it might not come out with the recording. We're doing some updates based on the federal contractor guidance just released, but we are making that resource available and constantly updating it with the latest and greatest news. You do want to make sure you get your hands on all the COVID-related COBRA forms. Again, unless you're using a COBRA administrator that's taking care of it for you, do make sure especially you get out that expiration of the subsidy notice to anybody on COBRA currently and receiving the subsidy. And as we said before, you do want to keep people abreast of notifications when it comes to COVID leave that may be available to them. And depending on their state, there may be requirements for you to notify employees of the COVID leave that's available to them. So again, double check your state, and if you're working with us in an HR capacity, check with your HR partner, or otherwise check with HR or legal counsel in terms of your requirements in your states for notifications for COVID leave or sick leave. Okay, then I quickly wanted to do just an ERTC update. We're doing a ton of work with employee retention tax credits. It's been really great. But for those of you who haven't been keeping up to date with it, the program was through ARPA signed to run through all 4 quarters of this year. But within the infrastructure bill that's currently being debated and coming close to passage, the most recent version of the infrastructure bill did cancel out Q4 of the employee retention tax credit. So should the infrastructure bill pass unchanged and nothing else pass to override it, the ERTC program would still be in place in terms of making claims. So there will be a 3-year window to claim credits for 2020 as well as the first 3 quarters of 2021. It's just that wages paid in Q4 would not be eligible for employee retention tax credits. It's a real shame because for those of you who are familiar or have attended previous educational sessions on ERTC, there are kind of 2 pathways to eligibility, one being a severe decline in gross receipts and the other being COVID-related restrictions on a business that suspended their operations in some way. So while most businesses' restrictions, or at least those related to COVID, are sufficient enough to qualify for ERTC, have been lifted in most states, that would mean that companies that would continue to be eligible for ERTC otherwise in Q4 would be those businesses whose revenues still haven't recovered to at least 80% of what they were at the end of 2019 before the pandemic started. So really, the companies that would be eligible for Q4 ERTC would theoretically be the companies that really need it. So there is hope, and there's a lot of arguing and petitioning going on at Congress. I believe a coalition of over 20 groups that represent smaller businesses have petitioned Congress to include language that would reinstate Q4 ERTC within the reconciliation bill that's also being debated in Congress. So not dead yet, not looking great, but there are efforts to revive the ERTC in Q4. But if I was a guessing man, I'd say it probably won't be, but we don't know. And unfortunately, it looks like we're going to start Q4 without knowing the fate of Q4 ERTC just yet. And then lastly, for those of you who have taken advantage of ERTC and are awaiting payment from the IRS, unfortunately, the IRS is continuing to experience pretty severe delays when it comes to turning those around and processing those and issuing checks to businesses, especially for those who had to file via amended returns. We're seeing waits of anywhere from 4 to 7 months on turnaround on those checks. But IRS is working on it. They do have additional offices now processing ERTC returns. They are making updates to their software. They were kind of flat-footed when it came to the program and how to process these. So they are working on it. We are seeing credits start to be issued, but it is largely a waiting game, unfortunately. For those of you, we can go to the next slide. For those of you who haven't yet explored ERTC for your organization and would like to, we do have some decision trees available. So if you're unsure about whether or not you may qualify for employee retention tax credits, either in 2020 or 2021, we do have some decision trees that we'd be happy to share with you that kind of walk you through the process at a very high level. Now, certainly if ultimately you end up in one of these green eligible spots, there are other variables. We do have certified professionals here that'd be happy to talk about these things and really help solidify your eligibility, but can give you a pretty good idea if it's something worth pursuing or not. And for those who are interested, whether you are an MP client or not, we do offer employee retention tax credit services, where we can work either with your iSolved payroll data or other payroll providers' data to help determine, calculate, and file for your employee retention tax credits. So that is something we're doing a lot of. We're very proud of our work here. To date, we've helped several businesses with their employee retention tax credits, and collectively we've helped those businesses realize over $20 million in ERTC money coming their way. So very proud. It's been very rewarding work for us. Okay. Yes, the presentation will be sent to participants. We'll send a recording of today's presentation. For state-specific mandates, is it for all employers or similar to federal guidelines, 100 or more or 500 or more? It really depends on the state. So the state has the discretion in terms of designing their COVID mandates or their COVID sick leave requirements. They set the threshold for what size businesses these things are subject to. We've got some questions specific to Illinois. I'll have to research that to make sure that I answer those accurately. I don't want to guess there. Great question. Do non-medical staff need to be vaccinated in a home care agency setting that is Medicare, Medicaid certified? Presumably, if they're working within the facility, but to be completely honest, that's just a guess. We are awaiting the formal guidance and rules on the Medicare, Medicaid certified employer vaccine mandate. But if I was to be a guessing man or a betting man, I would bet that at the very least, folks working within that facility would need to be vaccinated. And there is a chance where this is how it went for federal contractors, that even those who do billing or other non-medical work remotely may need to be vaccinated as well. So we don't know yet, but I'd venture to decide on the likelihood of yes. For the vaccine mandates, how about employers that have a mix of true employees and 1099 contractors? That will be discussed in the regulations as well. All I can say is that it might create more scrutiny for businesses that use independent contractors, and whether or not those workers are truly independent contractors or should be considered employees. It remains to be seen how the rules will go in terms of counting contractors as employees. Sometimes, like when it comes to here in Massachusetts, the paid family medical kind of disability coverage, it all hinges on what percentage of contractors you have as part of your total workforce, if it's more than half or not. So there might be something similar to that. But we do not know the answer to that question just yet, unfortunately. A local health plan that contracts with CMS delivering Medicare to Santa Clara County and not considered a government contractor. If you are Medicare or Medicaid certified, so basically if you collect payments from Medicare or Medicaid, you don't fall into the contractor category, but there's a separate executive order for a vaccine mandate for Medicare and Medicaid certified companies, regardless of federal contractor status. But again, the rules for that have not yet been published. Will masking and social distancing requirements, in addition to being subject for federal contractors, would those also apply to the Medicare and Medicaid businesses? Again, we don't know yet. Those rules have yet to be published. I would assume yes. Okay. Do you think the federal contractor mandate will begin before the private employer mandate? I would say yes. So as of right now, the federal contractor mandate is going to start in earnest on December 8th. So employees of federal contractors will need to be fully vaccinated and really be 2 weeks vaccinated from their final dose as of December 8th. Realistically, given the burden, frankly, that this is going to be on private sector employers, I would think that they'll give them some time. Most, if we look at private employers as a benchmark or a measuring stick, and I'm not sure what or who they consulted as part of their planning. Most private employer vaccine mandates that have been put in place so far have given their employees 60 days in a lot of cases to be in compliance. So, and given the speed of rulemaking at the federal level sometimes, I would guess that the rules will probably be published sometime in October. I would like to, guess that there'll be at least 60 days for businesses and their employees to become compliant with that. So it might not be long after that December 8th timetable for federal contractors, but I venture to guess, excuse me, that it will be sometime after that. It might be a January 1st, but again, we don't know just yet. All right, so it looks like those are the questions, or at least the questions that we can answer on today's session. I thank you. These were really good questions. I know there were some that require some additional substantiation. So in addition to today's recording, we will be sure to get those resources specifically for California as well as New York over to all of you. But again, thank you so much. It wouldn't be the same presentation without these questions. So this is what makes it exciting and fun for me. Hope that you learned a bit or learned a lot. If we can be of further assistance with any of this stuff, please do reach out to us at np-hr.com. We've got a team of certified HR professionals ready to help out. But with that, I will hand things back over to Amy.
Thank you, Paul. Really, really, really great, relevant program today. And thank you all for asking such insightful questions. As Paul mentioned, we will be sending out the link to the webinar. We'll send out all the resources along with Paul's slide deck today. And also be sure to join us next Thursday, same time, same place, for mass employer COVID sick leave program updates, critical guidance for compliance and preparation for the legislative updates. So again, that will be up on our site by the end of the day, and we'll be sending out marketing. So please register. Have a great day, everyone, and see you next week.